Good morning, everyone. Magandang umaga po sa inyo lahat. And thank you to IAS Educational Fund for bringing this forum in the Philippines. Thank you so much. Okay. HIV-related discrimination and stigma, where it leads to rights violations, is a human rights issue. People have a right to protection from discrimination and to a life of dignity where stigmatizing attitudes do not impede the enjoyment of their other rights, including the rights to education, healthcare, work, access to justice, privacy, family, bodily autonomy, and other rights. So for this session, we will understand the critical role of having a human rights-centered and a stigma-free response to end the HIV epidemic in the country. But before that, I would like to refresh your memories on the basic principles of stigma and discrimination. So, and write your answers to these questions. Mukhang ayaw. There. Okay. Question number 1. Okay. Okay, sorry. Parang ikaw na lang, mukhang hindi nagta-timing. Okay, I'll just, control it from your side. So, nandun na yung answer. Feeling that people deserve to get HIV because they are gays is a form of stigma. Okay. You got it right. Okay, next slide. Question number 2. Use of double gloving in attending an HIV client is an extrinsic manifestation of what? Discrimination. Correct. Okay, next slide. Question number 3. Blank is when a person takes in negative ideas and stereotypes about people living with HIV and start to apply them to themselves. That is internalized stigma, next slide, or self-stigma. Okay. Next question, please. For pill HIV, accessing HIV-specific health service, the most common form of stigma being experienced from the healthcare providers is blank. This is based on the Stigma Index study conducted in 2019. Guess what? Any guess? The most common form of stigma is, next slide, providers are advising our clients not to have sex because of their HIV status. Dr. Anita, mentioned a while ago that the primary motivation of everyone actually is pleasure. So why are we advising our clients not to have sex because they are HIV positive? So that's a form, the most common form of stigma. Next slide. True or false? The first step to reducing stigma and discrimination in healthcare facilities is by ensuring that staff members, even the reception, security guards, are educated about what stigma is. True? That's very, very true. Okay? Okay. Next slide. With that, I would like everyone to understand the stigma and discrimination. Both are interrelated, but quite different. Okay? HIV stigma is negative attitude and beliefs about people with HIV. It is the prejudice that comes with labeling an individual as part of a group that is believed to be socially unacceptable. And here are some of the examples. No? One, believing that only certain groups of people can get HIV, making moral judgments about people who take steps to prevent HIV transmission for those, accessing treatment as testing. Inililabel natin sila na, ay nako, promiscuous, kaya nagpapa-HIV test. That's very common. Feeling that people deserve to get HIV because of their choices. So that's some of the examples. There's a lot, of examples on about stigma. While stigma refers to an attitude or belief, discrimination is the behaviors that result from those attitudes or belief. This is what we call yung acted form of stigma. HIV discrimination is the act of treating people with HIV differently from those without HIV. And these are the following examples. I mentioned earlier kanina, one is a healthcare professional refusing to provide care or services to a person living with HIV, refusing casual contact with someone living with HIV, or socially isolating a HIV. And reminder, in the country's context, these discriminatory acts are punishable by law. We have an existing Republic Act 11166, yung acted form of stigma. HIV discrimination is the act of treating people with HIV differently from those without HIV. And these are the following examples. I mentioned earlier kanina, one is a healthcare professional refusing to provide care or services to a person living with HIV, refusing casual contact with someone living with HIV, or socially isolating a HIV. And reminder, in the country's context, these discriminatory acts are punishable by law. We have an existing Republic Act 11166. If you want, you can actually see kung ano yung mga punishment doon sa different acts of discrimination. Next slide. There. HIV stigma, we want to understand saan ba nanggagaling, yung stigma. Okay? HIV stigma is rooted in a fear of HIV. And many of our ideas about HIV come from the HIV images that first appeared in the early 80s. And there are still misconceptions about how HIV is transmitted. That's unfortunate because, we're coming in on the third decade of providing information. But based on the IBBS survey, awareness ang baba pa din, on the comprehensive knowledge on HIV transmission and prevention. For young people, it's just about 40%. Okay? And the lack of information and awareness combined with outdated beliefs and lead people to fear getting HIV. And additionally, many people think of HIV as a disease that only certain groups get. And this leads to negative value judgment about people who are living with HIV. So the lack of information, outdated belief, fear of HIV, moral judgment, cultural and religious beliefs played a critical role in our context, judgmental and the lack of empathy. And this has become a cycle. And if we keep on being silent about it, the cycle will go on. And we will not reduce stigma and discrimination in our country. Next slide. HIV-related stigma and discrimination significantly impacts the health, lives, and well-being of people living with HIV, and even those people at risk of getting HIV, especially key population, and in the Philippines, the young key populations, which is about 50% of the new infections. And stigma and discrimination impedes HIV response at every step, limiting access to prevention, testing, treatment, and other service and adherence, and the broader sexual and reproductive health services. including TB, mental health, and other health services. Next slide. Now, laws and policies must respect the principles of autonomy in healthcare decision-making, guarantee free and informed consent, privacy, confidentiality, and we should prohibit mandatory HIV testing. Prohibit screening procedures that are not benefit to the individual or the public, and ban involuntary treatment and mandatory third-party authorization and notification requirements. In our country, we've been working hard, particularly dun sa mga military, no? sa Philippine Air Force, Army. Before they are actually requiring HIV testing to their new recruits, it's a mandatory. But now, with the effort of partners, they're now easing up in terms of these policies. Now, linking rights and health outcomes. People living, this is based on data. People living with HIV who perceive high levels of HIV-related stigma are 2.4 times more likely to delay enrollment in care until they are very ill. That's the reason why we're getting, advanced cases na of the disease. A study of transgender women in Argentina showed that those who had experienced discrimination in healthcare settings were 3 times more likely to avoid healthcare settings than those who had not. And where programs have put in place to respond to stigma and discrimination, access to services for prevention, testing, and treatment has measurably improved. Next slide. This is just to show you that, that stigma index analysis, which is very important, found that HIV-related discrimination caused or contributed to job loss in more than 50% of cases in 7 of the 11 countries who conducted the study. And people living with HIV yung stigma index is a community-led research and advocacy initiative that includes a survey conducted by networks of people living with HIV. So we did this in 2019, and we're due to do this in this year as well. Next slide. This is what I'm mentioning, the index that we conducted in 2019, and we operated in this framework on the other side, knowing that the experience of stigmatization and discrimination among PLHIVs has dire consequences, and it can lead to the vulnerable population to hide their status due to shame, which could therefore keep them from being diagnosed, informed of the condition, and treated accordingly. And this actually play a role why we are still, the trend is still increasing in the Philippines. One of the very important information from that study, next slide, is that still around 15% of our clients are advised of not having sex, okay? Next slide. And next slide, please. Sorry. Okay, around 11.5% experience being talked badly or gossiped about, while 8.2% were denied of health services. And about 5% also reported they were advised not to have sex and their status was even disclosed to other people. Next slide. Now, we mentioned the 95-95. I agree with Dr. Nitaya. We need to look at the other targets as well, the less than 10%. Now, this is the Global AIDS Societal Enabler Targets by 2025. Less than 10% of people living with HIV report internalized stigma or experience stigma and discrimination in healthcare and community settings. Less than 10% of key populations report experiencing stigma and discrimination, and less than 10% of the general population reports discriminatory attitude towards people living with HIV, and less than 10% of law enforcement officers report negative attitudes towards key populations. Next slide. How do we do this? How do we achieve human rights and a stigma-free HIV response? These are the key principles to achieve human rights-centered and stigma response. We have to recognize the inherent dignity of every person, regardless of their HIV status. Treat all individuals with respect and equality. Ensure that people living with HIV are not discriminated against in any aspect of their life, including healthcare, employment, education, and social interactions. Informed consent and confidentiality is very important. And we develop, in partnership with the government, the Philippine National AIDS Council roadmap to address barriers to access HIV services. And we identified strategies on how to do this. So if you're interested, we can share you a copy of this PNAC roadmap in addressing human rights barriers. Next one is stigma reduction, education, and awareness. The first step is to reduce stigma discrimination in healthcare facilities is by ensuring that staff members are educated, okay? And we need also community engagement and legal literacy. We need to educate duty bearers and the rights holders, and language matters. This is very important. I'll give you some examples towards the end. But just to say that in terms of community participation, we are now implementing the community-led monitoring system. This is to ensure that the voices of the community are being heard. They are advocating for accountability, of the right holders to provide quality services. So we call this kumusta.ph. You can actually look at Google yung website. This is a reporting tool of of quality of service and anyone who experience stigma and discrimination. You can actually report through this platform. Next slide. Access to healthcare and support. Michael already mentioned the existing treatment and prevention and programs of the government. This is just to show you that we have a new treatment guidelines. This was in 2022, particularly emphasizing differentiated services, including the multi-month dispensing. Next slide. Legal protection, okay? We have a very good law. The Republic Act 1166 is anchored on human rights. But the challenge is on how to implement fully the existing laws. We also have some providing legal aid. We have a community, CSO providing legal assistance. And just to highlight on the other side, in 2021, DOJ and other government agencies issued a guidance on redress mechanism. So that's very good news, because if you experience any form of discrimination, you can actually come forward and avail of this redress mechanism program. Next slide. Okay. UNAIDS have specific recommendations. I will not dwell on it, but basically the country is already doing those interventions. We have legal literacy program, and of course, training of healthcare providers on human rights and medical ethics for HIV. Next slide. Next slide, please. You can download this, online, but just to, like I've said, you should know how to talk about HIV to avoid stigma. The words we use matter, okay? Ang hirap kapag nagsalita pa lang tayo ay stigmatizing na, paano pa maniniwala yung mga clients sa atin, okay? AIDS, alam naman natin, the difference between HIV and AIDS, okay? The phrases to catch AIDS, we're not using that. We use instead to be diagnosed with HIV. Unprotected sex, this is new, okay? Because, again, we should be using now sex without condom or medicines to prevent or treat HIV. To be more specific, because unprotected sex is often associated with sex without condom. There are more ways now of preventing sex, like PrEP. All right? So, para mas specific tayo to be more, to provide more clarity of what we mean. Next slide. Okay. To battle with HIV, we've been hearing this again, until now. But the more appropriate way is response to HIV and AIDS rather than battle. It's not a war. Okay? Risky behavior or higher risk group or groups with higher risk behavior. Instead, we use people with certain risk factors to be more politically correct. People who engage in behavior such as, or that may increase their chances of getting HIV. Risk factors such as, to be more specific. Okay? Because yung risk-related terms can be, again, stigmatizing and may imply that their conditions is inherent to a person or group rather than the actual causal factors. Okay? Next slide. AIDS patient, HIV patient. We seldom hear it from in a hospital setting. But the more appropriate way is person with AIDS or person, because it's the person first before the disease. Positives, AIDS or HIV carriers, okay? Because person is not HIV or AIDS. A person lives with HIV once he or she gets the virus or progresses to having an AIDS diagnosis. Next slide. Injecting drug user or IDUs, we now call them people or persons who inject drugs, okay? People who have an undetectable viral load have little risk of transmission. Again, just to highlight what Vin and Dr. Nitaya mentioned, it's not low risk. When you say U equals U, it's zero risk. Okay? So, undetectable is equal to untransmittable. Okay? Next slide. I think that's the last one. Okay, for the next steps, particularly in the context of the country, what do we want to do? One, we need to institutionalize stigma and discrimination reduction programs in all settings. Workplace, community, justice. Okay? We want to expand trainings on SOGI, legal literacy, and HIV education beyond key populations. Because we noticed that all of us here, we know stigma and discrimination. We know a lot about HIV. But outside this room, that's the problem. And they are actually causing stigma and discrimination towards people because they're not aware. Okay? It's our fault, because we're not engaging them in our discussions. So we need to have a more specific messaging for the general population. Strengthen redress mechanism. This is very important. We have an existing policy. We have to use it and popularize that there is an available redress mechanisms. Full implementation of the AIDS law. As I said, we have a very, very good law. Okay? Pero ang problem natin yung implementation. And we need to empower the community to demand for their rights. Because you are the rights holder. Lagi itong sinasabi. We need to raise our voice. Okay? And empower the providers as well as duty bearers so that they also know yung kanilang obligation. Right? So, with that, I want to end by saying that stigma-free response to HIV involves compassion, understanding, and a commitment to human rights. Good morning.